Welcome to the Signpost Study background training. Thank you for your interest in this study. As you know, a novel coronavirus, known as Severe Acute Respiratory Syndrome Coronavirus 2, or also known as SARS-CoV-2, infected over 200 million people worldwide, resulting in a global pandemic since March 2020. The disease caused by this coronavirus is commonly abbreviated to COVID-19. Over 6 million people in the UK alone contracted the coronavirus infection. As around 700,000 babies are born every year within the UK, thousands of babies are likely to have been exposed to SARS-CoV-2. Transmission of the coronavirus infection from pregnant women to their newborn infants is uncommon. In a cohort of women with confirmed coronavirus infection during pregnancy in the UK between March and April 2020, only 5% of their infants had confirmed coronavirus infection in the neonatal period. However, 25% of these babies born to women who had COVID-19 were admitted to the neonatal unit. Coronavirus is also uncommon in neonates. In the UK between March and April 2020, coronavirus infection was only confirmed in 5.6% of babies within the neonatal period. In this early period of the pandemic, the short-term outcomes of babies exposed to coronavirus, either antenatally or neonatally, are reassuring, as almost all babies infected by coronavirus were only mildly affected in the newborn period. However, we do not yet know whether coronavirus infection affects how these babies develop later in childhood. The aim of the Signpost study is to investigate the impact of antenatal and neonatal exposure to SARS-CoV-2 on children's development. To investigate this, we will assess children's cognitive, fine motor, gross motor, communication, and social-emotional development at 18 to 24 months of age. This will be achieved using questionnaires completed by parents, either online or on paper forms posted to them. The Signpost study is linked with two national public health surveillance studies that are conducted through the National Perinatal Epidemiology Unit at the University of Oxford. This includes the UK Obstetric Surveillance System, or UCOS, COVID-19 in Pregnancy Study, which assessed the prevalence of hospitalisation with COVID-19 infection during pregnancy, and the British Paediatric Surveillance Unit, or BPSU, Neonatal Complications of Coronavirus Disease Study, which assessed the prevalence and severity of COVID-19 infection in babies up to 28 days old. The Signpost study is working with co-investigators of the UCOS and BPSU studies and will approach UK hospitals that reported cases of antenatal and neonatal exposure to SARS-CoV-2 to the UCOS and BPSU surveillance systems. The Signpost study aims to recruit 3 cohorts. The first is an antenatal exposure cohort, which will include term-born singleton infants born at or above 37 weeks gestation, whose mothers were hospitalised with confirmed SARS-CoV-2 infection during pregnancy between 14 weeks and 36 weeks plus 6 days of gestation. Potential participants for this cohort have been identified through the UCOS surveillance study. The second is a neonatal exposure cohort, which will include term-born singleton infants with confirmed SARS-CoV-2 infection who were hospitalised in the first 28 days after birth. Potential participants for this cohort have been identified through the BPSU surveillance study. The final cohort is a comparison cohort, which will include term-born singleton infants who were born during the same period as the antenatally exposed cohort. For each antenatally exposed infant, 2 comparison infants will be identified, where 1 infant is born immediately before the antenatally exposed infant and 1 infant is born just after the antenatally exposed infant, preferably on the same day. There should be no evidence that the comparison infants were either antenatally or neonatally exposed to SARS-CoV-2. An overview of the NHS site setup pipeline for the Signpost study is provided on this slide. The Signpost study coordinator, who is based at the NPEU at the University of Oxford, is contacting sites where potential participants have been reported through the UCOS and BPSU studies to inquire about their interest in opening the study at their site, and will send a copy of the study protocol when staff are ready to receive this. Once an NHS site has confirmed an interest in opening the study at their site, they will be asked to identify a site principal investigator, or site PI. The site PI can be a non-medical clinician, for example a nurse or a midwife, if they are appropriately qualified to lead the study at their site according to their trust policy. The study coordinator will send the local information pack containing all study-related documents and the Organisation Information Document, or OID, to the site Research and Development Department. The OID will be used as the agreement between the participating NHS organisation and the sponsor, which is the University of Bristol. The NHS site R&D will complete and sign the OID agreement and return this to the study coordinator, and will assess whether it is feasible for their organisation to deliver the research study and issue confirmation of capacity and capability. Alongside this, the study coordinator will ask the site PI to confirm that they have read and understood the protocol, as well as an instruction letter from the chief investigator, and to confirm via email that the site staff are appropriately trained and qualified to carry out the study activities. Once these confirmations and signed OID are returned to the study coordinator will send the site an electronic investigator site file and greenlight the study to open at the site. The study coordinator can then begin sending study packs for eligible infants out to the site. It is the PI's responsibility to keep the electronic site investigator file up to date according to their local policy, including notification of any amendments sent by the study coordinator and CVs and good clinical practice certificates of staff working on the study according to trust requirements. Once the study has opened at the NHS site, the study coordinator will post the study information packs to the sites. For each infant that was reported to the UCOS surveillance system, the study coordinator will send a study pack for that infant containing their UCOS ID, as well as 2 study information packs to recruit 2 eligible infants for the comparison cohort. The site staff will be asked to identify 1 comparison infant born immediately before the UCOS infant and 1 born immediately after the UCOS infant, preferably on the same day. For each infant that was reported to the BPSU surveillance system, the study coordinator will send a study information pack for that infant containing their BPSU ID, NHS number and date of birth. Once sites receive the study information packs, the NHS site staff will be asked to identify the names and addresses of these potential participants and add their personal details to the study packs and post these study packs out to parents. After receiving a study information pack, participants can consent to take part in the study and provide their contact details and basic demographic information. This will be completed remotely, either online or by posting forms to the study researcher based at the University of Bristol. If parents consent to take part in the study researcher will send parents the Child Development Questionnaires when their child is 18 to 24 months of age. These questionnaires will also be completed by parents remotely, either online or over the phone with the study researcher, or by returning paper copies of the questionnaire via post. All questionnaires will be returned to the study researcher at the University of Bristol and not to the NHS sites. The study researcher at the University of Bristol will also monitor which potential participants from the exposure cohorts have not responded within 3 weeks of the study packs being posted out to parents, and will notify the study coordinator at the NPEU at the University of Oxford. The study coordinator will then send a reminder study pack for parents of infants in the exposure cohorts to the NHS site that identified them, and the NHS site staff will be asked to add the infant and mother's personal details to the pack and post these out to parents. Signpost NHS site staff duties. The Signpost study is designed to reduce the workload for NHS site staff. After the study has opened at the site staff will simply be asked to identify names and addresses of potential participants, Add these personal details to the study information packs and post them. Confirm with the study coordinator the receipt and dispatch of the study packs to parents. Maintain a log of parents or infants who were approached. And finally, to send reminder study packs to parents of infants in the exposure cohorts who did not respond within 3 weeks. We will now look at the study packs in more detail. The study information packs will include an instruction letter from the Chief Investigator to the NHS site staff, a study invitation letter addressed from the NHS site to mothers or parents of the infants, with a space for sites to write in the name of the recipient, a parent information sheet, 2 copies of an informed consent form, a non-participation form, and finally a study entry questionnaire. Each study pack will have a signpost ID pre-assigned to the study forms and where relevant the UCOS and BPSU IDs for the antenatal and neonatal exposure cohorts respectively. This will allow the central research team at the University of Bristol and NPEU at Oxford to monitor recruitment. An instruction letter from the Chief Investigator to the NHS site staff working on signpost will be enclosed in the study pack and will outline what to do. Site staff carrying out these tasks could be a research nurse or midwife, a UCOS reporter, or the site PI. For the antenatal exposure and comparison cohorts, first use the UCOS ID provided in the letter and study pack to identify the name and address of the mother who had confirmed SARS-CoV-2 infection during pregnancy. Next, add the mother's name to the invitation letter and use the local hospital database or NHS Spine to check that the infant born to the mother has not died or left the UK. Tick the checkbox in the letter when these activities have been completed. Next, use the local hospital database to identify 2 eligible comparison cohort infants, where 1 infant is born just before the antenatal exposure infant and 1 is born just after, preferably on the same day. Check that these infants were singletons at birth, not reported to the UCOS study as being exposed to the coronavirus during pregnancy, that they did not get coronavirus infection before they were 29 days old, that they had no congenital anomalies, that they were born at 37 weeks gestation or later, and that they had not died or left the UK. Tick the checkbox in the letter when this is completed. Next, add the mothers' names to the invitation letter and add the addresses for all 3 mothers to the corresponding study pack envelopes and post them. Please let the study coordinator know when these packs have been sent. Finally, please maintain a list of parents who were approached along with their signpost IDs and, where applicable, UCOS IDs, and keep the instruction letter on file following study pack dispatch. These should be stored in Section 8 of the electronic site file. For the neonatal exposure cohorts, a different instruction letter is included in the study packs. First, use the infant's NHS number, date of birth, and BPSU ID provided in the letter to identify the name and address of the infant who had confirmed SARS-CoV-2 infection during the neonatal period, as well as identify the mother's name. Add these names to the invitation letter and use the local hospital database or NHS Spine to check that the infant has not died or left the UK. Tick the checkbox in the letter when these activities have been completed. Then add the mother's address to the study pack envelope and post it. Please let the study coordinator know when these packs have been sent. Finally, please maintain a list of infants that were approached, along with their signpost and BPSU IDs, and keep the letter on file following study pack dispatch. To monitor recruitment, the study researcher based at the University of Bristol and study coordinator at NPEU will maintain a list of signpost IDs for participants who have consented to take part in the signpost study and those who have completed the developmental outcome questionnaires. The recruitment figures per site will be uploaded centrally to the Central Portfolio Management System, or CPMS, and the research team will also keep sites informed of their local recruitment figures. Our research team would like to thank you for your contributions to the signpost study. This study is critical to understand any long-term effects of COVID-19 on children's development. If you have any questions related to this study, please contact the research team using the contact details provided on this slide and within the study information packs. Thank you for watching this training material.